All right, hello everyone. So this is something very special because we all can see what is written here, that the first are always special. Well, hold your thoughts. I'm talking about MCQs only. Before you go into nostalgia, let me show you some important firsts. So first of all, let's talk about the first X-ray sign of osteomyelitis. The first X-ray sign of osteomyelitis is basically a soft tissue lucency, a soft tissue shadow, which is seen within 48 to 72 hours. So guys, I'm sure you all can see this bone. I'm sure you all can see the soft tissue. You can see the soft tissue. You can see this soft tissue as well. So the first X-ray sign of osteomyelitis is basically soft tissue shadow, soft tissue lucency, and this is that soft tissue shadow. This is that soft tissue shadow. Although it is not classical, it's a very non-specific finding. Therefore, what we say, I'm just adding one MCQ here. Therefore, what we say is that the first classical X-ray sign of osteomyelitis is technically the second X-ray sign, which is periosteal reaction. By the way, coming back, the first X-ray sign of osteomyelitis is soft tissue lucency or soft tissue shadow. So as I said, as I've already told you, that the previous X-ray which showed you soft tissue lucency or shadow, which is theoretically the first X-ray sign, but practically not. So practically, classically, clinically, diagnostic, hallmark, pathognomonic X-ray sign for osteomyelitis is periosteal reaction. I'm sure you all can see this added periosteal reaction here. I'm sure you all can see this added periosteal reaction here. One more fact, I'm going to give you a time set that the soft tissue shadow X-ray sign is seen within 48 to 72 hours, while this periosteal reaction is seen within 7 to 10 days. Moving to the next first. The first X-ray sign, I'm sure by now you all must have guessed it right. It is osteoarthritis of the knee, degenerative joint disease, wear and tear joint disease, weight-bearing joints more commonly involved, most common joint knee, most common compartment medial. Reason being, the weight-bearing axis does not pass through midline of the knee, it passes slightly medial to midline. Therefore, I can show you that the first X-ray sign of osteoarthritis of knee is reduction of the joint space, but in that reduction, always remember one thing, it is not a symmetric reduction, it is an asymmetric reduction where medial reduction occurs earlier and more as compared to the lateral reduction. So it is an asymmetric reduction of the joint space. You can see the narrowing of the medial compartment. You can see the narrowing of the lateral compartment. Medial compartment narrowing is occurring earlier and more than lateral compartment. I don't know whether you have guessed it right or not, but this is a classical. Okay, maybe this is not helping you much. I can show you this. So what do you think is this? Look at this vertebral body height. Look at this vertebral body height. Look at this vertebral body height. It's a classical tuberculosis of spine. Pott's spine. There's a reduction of the disc space. So the first X-ray sign, look at the, see, you cannot appreciate disc on an X-ray. Disc can be seen only on an MRI. So on an X-ray, when you cannot see an intervertebral disc, you can see a disc space. So you can see a disc space here. You can see a disc space here. You can see a reduction of the disc space. So first X-ray sign of Pott's spine is reduction of the disc space. One more first that I want to discuss with all of you is this. This is something which I want you to see. See, I want you to see a few things here. One, I want you to see reduction of the joint space. Two, I want you to see this, which is a periarticular erosion. I can show you one more periarticular erosion, periarticular erosion, periarticular erosion. But this is not that first. That first that I want all of you to see is this, the juxta-articular osteopenia, articular joint juxta-adjacent osteopenia. So first X-ray sign of tuberculosis of any joint, I've given you an example of knee, is juxta-articular osteopenia. Quick recap, the first X-ray sign of osteomyelitis, soft tissue shadow. Is that classical? No. So the classical X-ray sign is periosteal reaction. The first X-ray sign of osteoarthritis, reduction of the joint space, symmetric or asymmetric, asymmetric. Medial reduction occurs earlier and more than lateral reduction. The first X-ray sign of Pott's spine is reduction of the disc space. The first X-ray sign of TB of any joint is juxtaarticular osteopenia. So these are the few first X-ray signs where I wanted to integrate my orthopedics with radiology so that it becomes a very high-yielding video for all of you, and you always remember this. I wish you all the best. Stay tuned to the channel for more. Thank you.